So I am in that stage of life where we're all having kids and it's so much fun. And being the one who has my doctorate in physical therapy and loves working with kids, I get questions and phone a friends a lot. So today my friend texted me. I'm going to read it to y'all. Is it possible my 4-year-old is left-handed if he's having trouble with fine motor skills? I'm Kelsey Baas. I have my doctorate in pediatric physical therapy and founder of Compleo Kids. And I have had some questions coming in that I can't wait to share with y'all. So we actually went through this with our 5-year-old. Being left-handed, a lot of us think kids might be left-handed and then are surprised when they're right-handed. So the first thing to know is hand dominance actually does not fully emerge till age 3 or 4. So up until then, definitely be presenting things to both sides and don't get concerned if a child at age 2 is switching their hands a lot. But around 3 or 4, we do want to see hand dominance. And it is true, our world is created for righties. So sometimes if you have a kiddo who's left-handed, but they're only being presented with right-handed scissors and everything's given to them on their right and they're trying to mimic you and you always use your right, it might look like they have a little bit of difficulty with their fine motor skills. So I would start presenting things more on that left side, buy some left-handed scissors and see how they do and if they catch up. It probably was just that they were trying to use their right hand when they're truly left-handed. Now, one of the reasons we did a couple OT sessions was because at age 4, Scotty was still switching hands a lot. We really want our children to eventually develop a hand dominance because that is a sign of maturity in our brain. It is a sign that we can cross midline. So if we're coloring on a piece of paper and switch the marker and keep coloring like this, then we might have some neural pathways that need some help connecting because crossing midline is a very important skill. It's a skill I work on and talk a lot with our babies. So if your child is still 3, 4 and switching hands a lot, I would look into an OT evaluation because they might not be crossing midline. If they're struggling with skills, more with one hand than the other, again, you might just want to start to expose them to some more left-handed options. If the struggle still continues, then you would seek an OT. And if those fine motor concerns resolved, then you just have a super special lefty on your hands like we do with our 5-year-old. Comment below with questions you want us to answer. We want to give y'all what you need.